Again, this is Dr. Famous Favor. I'm just going to talk quickly on the abdominal pain by quadrant, because this is very high yield for the exam, for you to know some of the locations and where the some of the conditions and where the pain is located. So for example, we have the appendicitis. So in the exam, they can ask you about the location for appendicitis. So please don't forget the right lower quadrant, very high yield in the exam, the right lower quadrant, because they can ask you about the right lower quadrant in the exam. So that is where the appendicitis is located. But also remember that it can start as a periumbilical area before it gets to the right lower quadrant. And also remember the clinical the buzzword that goes with appendicitis, like the mark burning point, the rebound tenderness, the psoas, the obturator. So please remember all those because those are the signs that we see for positive appendicitis. So please read up those ones too, or you can look at other videos that we have on that. And we have the cholecystitis. Cholecystitis is and hepatitis is the right upper quadrant, and with that we have what we call the muffin sign. So you need to know what is muffin sign, and because it's very high yield in the exam. But now we are talking about the pain locations, because in the exam they can ask you about the different signs, but for the purpose of this video we are just focusing more on the location, the quadrant. So for gastritis and pancreatitis, you have it on the left upper quadrant, and it's a epigastric pain radiating to the back in pancreatitis. And also remember that in pancreatitis we have those signs, which is the gray turning sign and cooling sign. Please take note of those signs. We are not talking about it in this video, but just to note locations. Then we have diverticulitis. Diverticulitis is left lower quadrant, your left lower quadrant. So please master all these quadrants, because it's very high yield in the exam. Again, appendicitis is right lower quadrant, the cholecystitis is right upper quadrant, gastritis or pancreatitis is left upper quadrant, and diverticulitis is left lower quadrant. So take note of everything we have said. You can just use this mnemonic pain rule. Pancreatitis, left upper quadrant, the appendicitis, right lower quadrant. Patient will present with the mark burning point, pain at the mark burning point. So remember the blue bank sign, remember the psoas, the obturator. Those are the signs that you see with appendicitis. Then we have diverticulitis. Diverticulitis is left lower quadrant. Then we have the muffin sign also for cholecystitis. Please take note of all these signs, because it's also very important for the exam. Thank you.